Good day everyone. Today we will be discussing about the drug named Raloxifene. Raloxifene comes under the pharmacological category of selective estrogen receptor modulators. The mechanism of action of raloxifene occurs through binding to estrogen receptors. This binding results in activation of estrogenic pathways and blockade in tissues that express estrogen receptors. These receptors express as two different isoforms, the alpha estrogen receptor or activating effect and the beta estrogen receptor or inhibiting effect. Therefore, the expression of these receptors will modify cellular and tissue responses to estrogens. In postmenopausal osteoporosis, bone turnover dramatically increases. The bone resorption develops at a faster rate than bone formation, leading to a progressive loss of bone mass and bone mineral density. This disease represents an elevated risk for developing fractures. Raloxifene can inhibit accelerated bone resorption, both short and long term, increasing bone mineral density and enhancing bone strength. Other pharmacologic agents for the management of osteoporosis are estrogen, bisphosphonates, selective estrogen receptor modulators, parathyroid hormone, and calcium and vitamin D. It has an estrogen antagonistic effect in the uterus and breast, in contrast with tamoxifen, which is a first-generation selective estrogen receptor modulator and has an estrogen agonistic effect over the uterus. In addition, raloxifene modifies cardiovascular risk markers by decreasing LDL-C, fibrinogen, lipoprotein A, and increasing HDL2C without modifying triglyceride levels. Raloxifene is indicated in the treatment and prevention of postmenopausal osteoporosis. It is also indicated for the risk reduction of invasive breast cancer in postmenopausal women, demonstrating a high risk for invasive breast cancer or women with osteoporosis. The definition of high breast cancer risk is one or more first-degree relatives with breast cancer, or at least one breast biopsy showing lobular carcinoma in situ, or atypical hyperplasia, or a 5-year predicted breast cancer risk of more than 1.66%. Studies are underway on raloxifene as an adjuvant treatment for postmenopausal women with schizophrenia. It shows particularly promising results in mild presentations of schizophrenia. Raloxifene's most common documented adverse effects are hot flashes, flu-like symptoms, muscle spasms, arthralgia, and infection. Less common effects are insomnia, vomiting, sinusitis, deep venous thrombosis, bronchitis, pharyngitis, and breast pain. Raloxifene-treated women reported peripheral edema, muscle spasms or leg cramps, hot flashes, cholelithiasis, and venous thromboembolic events. The most serious adverse reaction related to raloxifene is venous thromboembolism, like pulmonary embolism, deep venous thrombosis, and retinal vein thrombosis. Contraindications to raloxifene include past medical history of deep venous thrombosis, renal vein thrombosis, pulmonary embolism, malignancy, active smoking, or any thrombophilia. Postmenopausal women with coronary heart disease or at increased risk for coronary events are at increased risk of death due to stroke when treated with raloxifene. Perform risk-benefit analysis in women with a risk of strokes, such as women with a history of transient ischemic attack or stroke, cigarette smoking habit, hypertension, and atrial fibrillation. Careful administration is recommended in hospitalized, immobilized, unable to walk, or post-surgical recovery patients, given the high risk of developing deep vein thrombosis and pulmonary embolism. The safety of raloxifene in premenopausal women is not established, and its use in premenopausal women is not recommended. Monitoring is recommended in patients with suggestive deep vein thrombosis symptoms, including redness, tenderness, and inflammation of calves and lower limbs. In such instances, patients should proceed immediately to the emergency department. Reports recommend suspending raloxifene 72 hours before and during an expected immobilization of a patient. Monitor hepatic profile and triglycerides levels, given the agonistic effect of estrogen over triglycerides. Monitor for any unexpected abnormal uterine bleeding. For patients with abnormal uterine bleeding in using raloxifene, it is recommended to establish a consultation with gynecologist. Initiate further workup to establish the source of the bleeding. An endometrial biopsy is suggested to rule out endometrial cancer. Thank you. Kindly comment for further queries and doubts.